hear from Dr. Robyn Cosford, a Sydney medical doctor, and Pauline, an independent nurse practitioner.
Scarlet fever, which is an infective disease caused by the streptococcal bacteria, was in existence and same sort of levels at that same time as whooping cough, measles, polio. And these are the diseases. And we do not vaccinate against scarlet fever. We never have vaccinated against scarlet fever. And interestingly, the incidence of scarlet fever has dropped off, paralleling the drop in whooping cough and polio and so on. So it would appear, when we actually consider these other factors as well, that it's not the vaccines that have reduced the incidence of these diseases, but other things that were going on in society at the time. There were basic public health measures and sanitation measures, and these seem to be the things that have made the major impact.
And some of the studies that have been done indicating that it wasn't the cure-all that everybody thought it would be, and that in fact there'd been some massive disasters around the world following vaccination programs. And that measles, for example, was dying out in Europe, and then they started the vaccination program and it rose again, and that the thing that had cured measles was in fact the better nutrition programs, a simple general pick up in the health of the population, increase in vitamin A levels. And the vaccination wasn't solving these problems at all, that just as many people were getting sick post-vaccination as they were before.
So not only does it appear that vaccines do not work, but there is evidence that they are in fact counterproductive. Back to the United States.
This is the incidence of whooping cough, morbidity and mortality from whooping cough, deaths from whooping cough between 1922 and 1987. You can see a steady downward trend in both morbidity and mortality until about 1978. I wrote this down here myself, because after 1978 you can see this very unnatural, sharp upswing in the incidence of whooping cough, and mortality remained stationary.
So what happened in 1978?
In 1978, a nationwide childhood immunization initiative was begun. Individual states passed legislation requiring proof of immunization for school entry at 5 and 6 years of age. They mandated vaccination, and it resulted in a threefold increase in the reported incidence of whooping cough. And indeed, children develop whooping cough from the vaccine. And when I say that, of course, vaccinators are up in arms, saying that a child cannot contract whooping cough from the vaccine. But of course, because Bordetella pertussis is dead in the vaccine. But whooping cough is a toxin-mediated disease, meaning it doesn't matter whether Bordetella in the vaccine is live or dead, or whether it is there at all. Because the acellular whooping cough vaccine doesn't contain whole cell Bordetella pertussis. It only contains the protein envelopes. And children can still develop whooping cough from that vaccine.
After 20 years of immunization in 1989, the mortality per 1,000 people in Europe was 10 times less than it was in America. So the Swiss, in spite of having no immunization policy, had 10 times less mortality from measles than did the United States, which by that stage had a 20 years of vaccination experience and had mandated it.
The most interesting thing about this situation in the United States is that the Amish, it's a religious group who reject vaccination on religious grounds. The Amish didn't report a single case of measles between 1970 and 1988. For 18 years, the unvaccinated Amish did not report a single case of measles.
But what about smallpox? Hasn't it been eradicated? Well, vaccination seemed, with this too, to only slow the decline which had already been occurring. Dr. Archie Kalokerinos is a medical doctor and author well known for his success with vitamin C in his work with Aboriginal children.
There was a big epidemic of smallpox in the Philippines, and this was a very important epidemic in many ways because statistics were kept for the first time. And it was clearly demonstrated that the only people who got smallpox twice were the vaccinated, and that there were far more cases of smallpox amongst the vaccinated than amongst the non-vaccinated. And these statistics are available if people want to see them. Now, I think these are the most glaring examples of how people are being misled.
Smallpox outbreaks are, in fact, still occurring in Africa, Asia and India, where there is conflict and poor nutrition.